In Kenya, a new generation of health journalists and public health communicators is being equipped with skills to bridge the gap between complex medical information and public understanding. The latest cohort of health journalism and public health communication program has just completed their training.
This partnership between KEMRI, Willow Health Media, Clean Air Africa was born out of a simple but powerful idea that knowledge in health and science must not remain confined within laboratories, boardrooms, reports, and conferences. That for knowledge to truly serve the public, it must be translated into accurate, engaging, and impactful stories that people can understand, trust, and act upon. Over the past 8 weeks, the participants here have been equipped with skills to report responsibly on health issues, to navigate complex scientific data, and tell stories that matter. And you know stories matter because it's the stories that people will remember, they'll quote, they'll make reference to.
10 fellows completed an intensive 8-week training.
We expect you also to address impact of climate change and air pollution, particularly on the vulnerable population, climate change and air pollution. And examples here where we have more expectations is particularly the target group that are very needy in terms of the low-income communities, children, and also the elderly.
KEMRI remains committed to building research capacity and bridging the gap between science and society. Dr. Joseph Mutai from KEMRI's Directorate of Research and Capacity Building delivered remarks on behalf of the Director General.
The significance of your presence at this occasion underscores the importance of cross-sector collaboration in advancing public health communication. We sincerely appreciate your support again and look forward to working closely with you to achieve our shared goals. I would also like to extend my heartfelt gratitude to our facilitators who generously shared their expertise with our participants, to our partners including Clean Air Africa, the University of Liverpool, the Willow Health Media Initiative, and the dedicated team at the KEMRI Graduate School who worked tirelessly behind the scenes.
Willow Health Media worked with the participants to develop impactful health stories. KEMRI's graduate Jason Robert Kesa shared his experience.
I did a story about how low-cost AI is transforming healthcare, and it doesn't have to be the expensive solutions, just being simple solutions like a simple text message. So I examined 2 cases, and that is Jacaranda Health, which is using a tool called Prompts to send SMSs and guide mothers on how to get healthcare during pregnancy. I also examined Penda Health Clinics, which is using an AI model to check through the patient records to weed out any misdiagnoses and errors.
Christine Nguku, Assistant Director in charge of Training and Curriculum Development at the Media Council of Kenya, recognized the importance of this training initiative. She addressed the graduates about their responsibilities as health journalists.
On your part as journalists, as writers, health reporting demands courage. It demands responsibility, and it demands resilience. In a world flooded with misinformation, you stand as guardians of truth.
Several projects addressed clean air, textile and medical waste management, and neglected tropical diseases. The graduates were reminded of their responsibility to continue telling these stories and communicating health matters.
And this responsibility is to uphold the truth, accuracy, and empathy in telling health stories. Those are some of the principles in which Willow Health Media we stand upon when we are doing our stories, and we hope that you also carry this responsibility with you. You are now ambassadors of science communication. You carry forward the mission of bridging the gap between research, policy, and everyday lives of Kenyans and the audiences you reach out to. We at Willow Health Media are committed to strengthening this partnership and continuing to invest in the next generation of health journalists and public health communicators.
For Willow Health Media, my name is Yvonne Korir.